Evidence-based practice station is a silent station in NMC OSCE, like professional values and behavior station in NMC OSCE. This station is silent writing station of 10 minutes duration. You would have seen our video on professional values and behavior station. This station is similar to that station, except of the fact that topics are different, and you need to analyze studies given. Fortunately, you will be asked only about one of the following 14 topics to be answered in the station. Number of topics is increased to 14 topics. You should make sure that you learn these marking criteria by heart and answer corresponding to question. The topics asked in evidence-based practice station are the following: diabetes, female myocardial infarction, pressure ulcer prevention, smoking cessation, use of honey dressing for venous leg ulcers. We have given link for our video on the above said topics in description of this video. The newly added topics from November 2022 are ankle sprain, Asperger's syndrome, bedside handover, cervical screening, cranberry juice and urinary tract infections, dementia and music, fever in children, restraint, saline versus tap water. Framework of question. You will given the following in your question. Topic: scenario involving a patient. 3 studies conducted and their result, along with a conclusion. An answer sheet where you need to write in bullet points about the relevance of research findings and the advice you are giving to the patient. Now, let's look on these new topics one by one. First topic is ankle sprain. Scenario will be like patient Xi, who is a patient of yours, has got ankle sprain. Doctor has prescribed paracetamol for the patient. Xi is wondering whether ibuprofen is better in this case rather than paracetamol. You will be given studies in relation to this. Your answer should be like: summarize the main findings from the article summary and draws conclusions, making recommendations for practice. Inform Xi that both paracetamol and ibuprofen are equally effective analgesics. Explains to Xi that some clinicians prefer to prescribe ibuprofen, but there is no clear evidence that it is superior. Advise that the current available research suggests that paracetamol is an effective analgesia for pain resulting from soft tissue injuries. Explain to Xi that, although ibuprofen is safe, it can have more adverse effects and be contraindicated in patients who have bronchospasm, cardiac and renal failure. Recognize that Xi is asthmatic and advises that paracetamol would be more suitable. Next topic is Asperger's syndrome. Scenario will be like MR. Charlie concerned about his friend Leslie, who has Asperger's syndrome. Charlie is complaining that healthcare professionals are not understanding Leslie's problems. Leslie is having problems with mental health and is showing self-injury behavior. Your answer will be: summarize the main findings of the article summary and draws conclusions, making recommendations for practice. Explain to Charlie that healthcare professionals' poor knowledge and lack of understanding of autism are likely to be a barrier to those people who have autism accessing mental health support and treatment. Consider that healthcare professionals may need additional training to communicate with people who have autism. Explain that people who feel disregarded by healthcare professionals are less likely to seek further help. Inform Charlie that a study reports that highly functioning patients who have Asperger's syndrome are affected by a misperception that health workers believe that they are able to cope as they were employed or at university. Consider that mental health support and treatment may help Leslie's overall well-being and improve his self-injury behavior. Moving on, next topic is bedside handover. Scenario will be like MR. Tanvir is a registered nurse who is concerned about doing handover at the patient's bedside. He thinks it will leak the sensitive and confidential information. He also has the opinion that the patient won't prefer bedside handover as well. Your answer will be: summarize the main findings of the article summary and draws conclusion, making recommendations for practice. Inform Tanvir that research has shown that adult patients and nurses both prefer handover at the bedside rather than elsewhere. Inform Tanvir that most patients find bedside handovers beneficial as they feel involved in their own care, and it supports two-way communication. Advise Tanvir that patients prefer to have a family member carer friend present and to have 2 nurses rather than the nursing team present. However, having a family member carer friend present was not considered important by nurses. Explained to Tanvir that, while patients expressed a weak preference for having sensitive information handed over quietly at the bedside, nurses expressed a relatively strong preference for handing sensitive information over verbally away from the bedside. Advised Tanvir that developing the process and design of bedside handover can improve the implementation of this important patient-centered safety initiative in hospitals. Next topic is cervical screening. Scenario will be like one of your patient, Roshni, is worried about her current sexual behavior and the risk for cervical cancer. Your answer will be like: summarize the main findings of the article summary and draws conclusions, making recommendations for practice. Explain to Roshni that the main cause of cervical cancer is human papillomavirus, HPV. Inform Roshni that it can take between 10 and 20 years for cervical cancer to develop from an HPV infection. Therefore, a woman's current sexual behavior does not necessarily reflect her current risk. Explain that the peak age for developing cervical cancer is 30 to 45, but it can occur in anyone who has a cervix, irrespective of age. Discuss any concerns and/or fears about screening with Roshni. Advise Roshni that she should attend for screening every 3 years until she turns 49, when she should attend every 5 years. Women will be invited to attend after 65, only if they have previously received an abnormal result. Next topic is cranberry juice and urinary tract infection. Scenario will be like Miss Frida has been diagnosed with UTI. She is asking you whether drinking cranberry juice daily would prevent occurrence of UTI in women. Your answer will be like: summarize the main findings of the article summary and draws conclusions, making recommendations for practice. Explain to Frida that there is some research that shows that cranberry juice may prevent a UTI occurring in healthy individuals if drunk regularly. Consider that cranberry juice may be less likely to induce nausea than other sugary drinks when taken regularly. Inform Frida that there is no evidence available that cranberry juice may prevent UTIs in individuals who have high-risk conditions or those with indwelling catheters, as people in these groups were not included in the study. Explain to Frida that there is no evidence available to suggest that cranberry juice can be used to treat a UTI in place of antibiotics. Inform Frida that it is necessary to note that the research was funded by a leading cranberry juice manufacturer, indicating a potential conflict of interest. Next topic is dementia and music. Scenario will be like Mrs. Bindu is one of the patient of yours who has got dementia. Bindu's daughter is asking you whether music therapy is beneficial to improve symptoms in dementia. Your answer will be like: summarize the main findings of the article summary and draws conclusions, making recommendations for practice. Inform Bindu's daughter that research trials have been conducted where music therapy has been introduced, and that they have had some benefits for individuals who have dementia. The patients involved in the study had all had at least 5 music therapy sessions. Explain to Bindu's daughter that there is a lack of evidence that music therapy can improve symptoms of agitation. Explain that the current research available suggests some evidence to show that music therapy can positively improve depression, and this may provide a rationale for implementing music therapy. Inform Bindu's daughter that music therapy may have a positive effect on the overall quality of life of individuals who have dementia. However, this evidence is less reliable than the evidence on depression. Inform Bindu's daughter that there is no clear evidence on how long the effects created by music therapy remain after the activity stops. Next topic is fever in children. Scenario will be like you have a patient, child, who has got a high temperature. Child's mother's name is Selai, and she is worried of giving ibuprofen to her child, as she has heard that there is many side effects associated with ibuprofen. Your answer will be like: summarize the main findings of the article summary and draws conclusions, making recommendations for practice. Explain to Selai that the fever is an important immune mechanism in fighting the underlying infection, and that it is recommended to treat a fever only if it is causing the child distress. Consider that either paracetamol or ibuprofen can safely be used to treat the fever. Inform Selai that ibuprofen taken in the short term, up to 7 days, should not be taken with food to gain the optimum effects from the medication. Consider whether the child has asthma, as both ibuprofen and paracetamol can exacerbate respiratory symptoms. Explain that healthcare professionals may perceive that ibuprofen has more adverse effects than paracetamol, but that there is not the evidence to support this. Next topic is restraint. Scenario will be like Emma. Bava is one of the visitors of a patient in the ward and is seeing one agitated patient in the ward. He asks you, why can't you restrain the patient, which will keep both patient and staff safe? Your answer will be like. Summarize the main findings of the article summary and draws conclusions, making recommendations for practice. Explain to Bava that compassionate communication may prevent the need to restrain patients. Considers that physical restraint may be necessary to promote the safety of staff and patients as a last resort after other options have been exhausted. Inform Bava that physical restraint may promote fear in patients and distress among staff. Consider that physical restraint may be perceived as a demonstration of power that staff display over patients. Explain that the use of physical restraint may create a loss of trust and a breakdown in patient and staff relationships. Next topic is saline versus tap water. Scenario will be like Miss Fiona has wound, which she thinks need to be cleaned with sterile saline, rather than tap water. You are the nurse doing the wound assessment and dressing. Your answer will be like. Summarize the main findings of the article summary and draws conclusions, making recommendations for practice. Inform Fiona that trials comparing the occurrences of wound infections when cleaned with sterile saline or tap water have shown no difference between the two. Advise Fiona that there is a lack of available evidence on the effects of water or saline on wound healing. Make Fiona aware that there are no differences in patient satisfaction in either group. However, there was a lack of robust evidence on the instances of pain experienced by patients or on adverse events. Highlight to Fiona that there were no standard criteria for assessing wound infection across the trials, which limited the ability to pool the data across studies and limited the results. Explain to Fiona that tap water has been recommended as a cost-effective option for wound cleaning. To summarize, in this station, you will have to remember following thing. You will be given the studies of which you need to summarize and recommend. Only 6 advise or information or recommendation to be given. This is a silent station and demands only writing. Wordings of your advice should be appropriate and is topic specific. Need to memorize your marking criteria. Handwriting should be legible and neat. Need to practice writing within time. This station seems to be easy as a silent writing station, and the topics are given in marking criteria. But, as a matter of fact, there has been failures in this station, mainly because candidates couldn't memorize the topic-specific interventions. So please make sure that you learn the marking criteria and practice it, writing down within the given time frame of 10 minutes. For more useful videos which will help you prepare for an NMC OSCE, please like, share, comment, and subscribe to this channel. Also, our OSCE guide is available on Amazon.com, which is NMC OSCE for overseas nurses, written by Lovelin Joshi. Please check our free website, which has all the articles related to NMC OSCE, at www.oscetrainer.com. Thanks for watching.